All right, welcome back, and this is still the AM show. So Elton and I were having a conversation earlier on in the news review, if you missed it, and he was telling us about how the Ghana Health Service has been telling us that the daily cases of COVID-19 have gone up from about 4 cases a day to almost 400 a day. So obviously we're not doing very well in terms of the cases that we have at the moment. We have 3,165 active cases, 321 new cases. So figures a little bit, not alarming, but definitely very worrying. So we want to speak to Dr. Fred Adomako-Boateng. He's the Bondi East Director of Health, just to sort of pick his mind and his thoughts on these rising figures and what we can do about it. Good morning, Dr. Adomako-Boateng.
Yeah, good morning. How are you?
I'm very well, thank you. It's good to talk to you again.
Nice to talk to you too.
Okay, so numbers going up. Were we expecting this, and at this level?
Obviously, I mean, if you look at the what we saw in South Africa, if you look at what we saw in the States, and if you look at what we are seeing in UK, just a matter of 2-3 days, it will be the dominant variant, because now statistics telling us that in US it's now almost the leading. And if you look at the doubling rate for Omicron, every 2 days, or let's say every 1.5, you double the cases. So if you are talking about 2,000, exactly within 2 days, we'll be talking about 4,000. And within another 2 days, we're talking about 8,000. So you see how Omicron is behaving. So it's something to be expected. It's not out of ordinary we are seeing in Ghana.
Okay, I mean, so that's the behavior of Omicron, but what's about the behavior of Ghanaians? Because I'm sure, if we, maybe had stuck to the protocols, and we always kind of get a heads up when it comes to these new variants, because, it's gotten somewhere else and then we hear about it, and we have, maybe a couple of weeks before it hits us, and we have that space where, we can take precautions and perhaps avoid, getting infected. What's about our behavior? What is it in our behavior that's allowing these kind of numbers as well? 321 new cases.
And that's, the discussion is that our behavior is a reflection of what we are seeing. Time and again, we know the try and tested ways of preventing this pandemic. It's the strict protocols. I mean, we have seen in countries where even the vaccination rate is very high, but the moment they lose guard of the protocols, you see that we come back to square one. So what we are seeing is just a product of how we are adhering to the protocols. And time and again, I think we have emphasized this over and over again, that the basic prevention actually handles almost every pandemic and outbreak that you can think of. Before you think about maybe even the chemicals, for example, drugs or vaccines. So if you're able to stick to the basic preventive methods, and they are not new, irrespective of the variants that we are talking about, people should just wear the mask. It's as simple as that. And if we refuse to do that, hand hygiene should be practiced. And now, we should just decide to cut large crowds and gatherings, because we know that they are the super spreader. So until we decide, yesterday, a friend of mine got an invitation to come to a party for a housewarming party, because somebody had built a house that he's inviting people that he's moving. These are the behavior that are going on. So unless we begin to change, we are in for a hard time.
Yeah.
People are hiding behind the fact that, and that one, we have to be careful that the severity is not as much as Delta. But if they are in early days, and if you look at those populations that they are talking about, the rate of their vaccination is really high. And if you can just do the mathematics, it's about 2 to 3 times infectious than Delta. So if you are talking about, let's say, about 50,000 people getting it, you see the burden that will come to our health facility. So if, let's say, you are talking about 20,000 with about, let's see, about 1% of that 20 or 2% of that 20,000 becoming severe and therefore needing hospital admission. Now you are talking about 100,000. And in that case, the numbers that will get the severer form and needing admission and hospital care will be higher, despite the fact that we are saying it's not severe as compared to. But in terms of numbers, our health systems are not ready for that. And mind you, our health workers are also going to be involved in this issue, and therefore the numbers that you need to attend to this will not be there.
Yeah. And
even the kind of infrastructure and expertise that has been our challenge from the beginning of the pandemic has not actually been solved. You need the critical nurses, physicians, emergency physicians, and anesthesiologists to handle these severe numbers, which we have not been able to add over this short period. So I think it's time that we advise ourselves the things that we have planned. And I think I saw this on your news yesterday, that event cancel is better than live cancel by WHO. I think let's go back to that. And all the events that we have planned, it's better that we do away with the events so that we can have a better 2022. It's not late yet. We still have the time to be able to address it.
I was just going to ask you about that because you talked about the super spreader events. And obviously, I mean, it's almost a few days to Christmas. There's a lot of events. There's a lot of parties, concerts, raves, and all of those things. What kind of measures do you think that we can put in place now so that we don't see a repeat of last January?
Okay. So I'll go with the basics. One, I'll start from the individual level, family level. Now, it means that if you have not been with somebody within the 2 weeks, if you don't know somebody so close, you have not been having any interaction with somebody within the 2 weeks, 14 days, please, this is not the time that you engage that person. That is on the individual note. So that if you are going for an event, and definitely you are going to meet, quote-unquote, strangers, then you have no business going to that place. That is the first thing. And I think if on individual level you're able to do that, then I think it will address most of the other questions that we are talking about. You don't invite somebody to your house if you have not been so close to the person within even 2 weeks. I have given you the luxury, but it's within 7 days. So that's what I would say. Secondly, let's cancel all indoor activities. And even if you are going to do it, I would say that reduce the number to half. Reduce the number to 10. If it's possible, that is what you have to do. And every activity should be outdoor. Now, we know we are going to this Christmas. We have a lot of church services, retreats. Let's look at what we are celebrating. We are going to celebrate the life of the birth of Jesus Christ, which brings about peace, harmony, and then life worth living. So I'm asking the question, the celebration that you are going to go and do, if you look at the long term, is it actually going to achieve the purposes of what you are celebrating? If not, let's think twice. Decision making is not easy, but at times you have to take bold steps. Bold steps. Let's come out and decide together, like, look, let's go back to our social distancing. I believe that the president's directives have not changed in a way that we are supposed to organize our church programs, our mosque, the number of hours we are supposed to be in churches, the number of people that are supposed to be there, the measures that we are supposed to put in place. I believe the directives have not changed. But it seems like the directives have changed. Let's go back to all those and then begin to enforce them. And I believe that if we're able to go that, it will solve a lot of problems. But we have to be bold. That's what I would say, Anua.
Okay, all right. Those who are organizing some of these events will argue that they've put so much money into it, And I saw a directive from the Ghana Health Service talking about the fact that churches, for example, 31st service should be held either online or indoors. I mean, now these are great directives, but we know as Ghanaians we haven't had time to kind of get into the mood, because what it's actually been asked of us effectively is to suddenly switch from feeling like we're completely safe and we're okay to chill to, okay, no, actually you're not okay to chill and you cannot go out, and you have to switch back to that. So you know how human beings are, we're going to need a bit of time to kind of, get into the vibe of, we're back on, on not being able to do certain things. How important is enforcement going to be in making sure that the numbers are, are kept at a minimum? Or are we just going to trust people to do the right thing?
It has to be enforced by the enforcers. It has to be enforced by the enforcers. We will have to. It's not easy to make those decisions anywhere. It's not easy to make. I mean, as you said, a lot of investments have gone in. But yesterday, or about 2-3 days ago, I was discussing with a colleague, and I said, look, despite the investments that have gone in, if you add all these investments, it's not able to buy one soul, any of us, one person. In fact, if all the investments that have gone in, do you really want to miss a laugh or lose a dear one? Those are difficult decisions. We are not forecast to make those decisions. It's not easy. But what do we do? How many activities and Christmas do we have ahead of us as compared to this? And that even makes it more difficult to take the decision. If it had been any other day, the decision is easier.
Okay.
But now, that is where you have to take the decision. And the enforcement are enforcement. There is no other way that we can discuss all these. If you are even going to hold it, then you have to take responsibility. One, that everybody coming seriously must. Everybody entering, you give sanitizer for them to sanitize their hands. And even when they are in, you make sure that everybody is religiously masking. If there is a need, I will then go back to the fact that then it means that in such programs, even if people are going to eat, it has to be organized in such a way. Because what actually happens is that when people are in mask and they start to eat and they take off their mask and they are talking, that is also another super spreader. When people start talking. So people who are then going to hold the event should be responsible for all these measures. That is what we can see. And then the numbers. Mind you, we are not supposed to be in gatherings more than 2 hours. I don't know whether that has changed. So these are, we know what to do. The event organizers should then take the responsibility in ensuring these things. Can we organize these outdoors where it's so safe as compared to things indoor? Because the moment people go indoor, especially, and when they go indoor, they don't even vent, they start using air conditioning and all those. And even that puts a lot of people at risk. The 6 feet that we talk about, the moment you go indoor, it becomes less. So these are the things that we will have to do. Those of us going to the market, going to sit in trucks and taxis, are we going to be in the market? Those are the things that we have to start talking about. Because our behavior today, tomorrow, will show what will happen in about 2-3 days. And mind you, Omicron is not giving anybody that luxury. The doubling rate has never been seen before. And that is what the virus is going to do. If there is also going to be another variant, you see, the doubling rate will be higher, but the severity will reduce. And that is the nice and the wisdom of the virus, so that it will be able to infect a lot of people and survive. So the fact that the severity is decreasing is an advantage for us. It's the survival mode of the virus adapting, so that a lot more can be infected. And if you look at the quantum, the numbers of the severe cases that are going to come, it will be more than the previous one. So that is the way the virus is behaving. It's up to us also to adapt and go back to what we are used to do. So the question is for all of us. Do we celebrate because we have made a lot of investment and pay for it later on? Or do we take the bold step and start cancelling events so that life will not be cancelled?
Yeah. Okay.
These are things that you have to think about. Even if we don't cancel the event, what are the nice ways that we can go around it boldly?
Okay.
And then these are things, discussions that we should have. And we have a lot of things going on. What is happening in Netherlands now, as we talk about anywhere? What is happening in Germany? You know, Joe Biden came and he's been lambasted with the issues that he spoke on Tuesday, that it has nothing to do. So these are things that we will have to discuss among ourselves in the context of our situation, and then fashion a way out for us well. Because other than that, the new year will not be a nice new year. Happy New Year, we cannot see for 2022 because of our very behavior. I will still stress on this point that event cancel is better than life cancel. Yeah. And one life is so precious, especially if it's so close to you. God forbid your mother. Yeah. And these issues, you know, the young ones who are energetic for majority of the population, they are in terms of they will survive, but they will bring it to people who are more vulnerable, having the comorbid issues. How do we go about it, all of us together, and address this issue?
Yeah. Okay. Well, thank you so much for joining us, Dr. Fred Adomako-Boateng. He's a Bono East Director of Health, and we're having a conversation on the rising numbers of COVID-19.